Good morning, everyone, and welcome to Alliance Live, the online information and learning portal, showcasing examples of innovation and integrated working taking place across Scotland within health and social care. Today, we continue our series of webinars focusing on the development of a self-management resource for people living with COPD during the COVID-19 pandemic. This tool, created by our self-management network member Felix Agako from Pharmatics Limited, is based on the latest official guidance. The Q&A session will follow on once Felix has finished his presentation, and then we'll bring our webinar to a close. So now, without further delay, over to Felix.
Yes, hello. I'm Felix Agako from Pharmatics, and I'm sharing the screen. Is this working properly, Carmen? Could you confirm?
Yes, it is. Yes, thank you.
Thank you. We are experts in medical artificial intelligence, and we are working on smart personalized self-management of chronic lung disease. And more recently, the focus has been on COPD during COVID-19. COPD, chronic obstructive pulmonary disease, is a horrible, debilitating illness. I cannot go out. I went out and couldn't get any air. I thought that was it. The words of one of our COPD patients whom we spoke with. COPD is a major cause of emergency admissions in the UK. It affects a large number of adult population in the UK. There's an even bigger problem in Scotland. And in the post-COVID world, self-management of COPD is set to change. Many people with COPD need to shield. Some symptoms of acute exacerbations and symptoms of COVID-19 are similar, so guidance needs to change, and it's not very clear how to do this yet. Current care, self-management care, is quite often one-size-fits-all. So patients quite often get a one-off self-management plan, which is given to a patient, and access to support is rather limited. As a result, what we have seen is that adherence and accessibility of support of self-management is relatively limited and adherence is poor. Sometimes the choice of the right treatment, such as the use of rescue packs, is delayed, sometimes by days of deterioration, which extends the duration of exacerbations and may potentially result in hospital admissions. And currently, self-management care and guidance has not really accounted for the impact of COVID-19. Our solution to this is a digital tool which will try to personalize self-management based on the latest guidance. Basically, it's a snapshot of how the app looks like. I'll show a working version of the app very quickly. Patients are invited, or users of the app are invited to submit the symptoms. Based on that, they get predictions for today. In principle, we are set up to show the predictions for tomorrow as well, predictions of the risk of exacerbations. But for until we go through clinical trials, we cannot legally display this. We can only use those predictions to guide self-management through trusted sources, which is what we are doing in the app. So people will get breathing techniques and various exercises and recommendations of online materials based on the patterns which we can see for today and tomorrow in the data. People can also look at the historical data and get the latest information on air quality in Scotland. The initial development was funded by Nesta, which helped us to develop the initial prototype of this, basically an AI-powered digital educational tool. The work on COPD during COVID-19 and how to generally do health-related artificial intelligence and mine the evidence is funded by the European project ASICA, which includes us as a node and also the University West of Scotland, and it's led by the University of Barcelona. And we are also developing an IT platform to enable clinical validations of the app and delivery of this app as part of the NHS app with Innovate UK, and this involves colleagues from the University of Edinburgh. Now, We work very closely with our friends and colleagues from the group which is called the Chain Gang. It's a snapshot of that group. Basically, it's the Singing for Lung Health group. Respiratory nurses and GP nurses who run the group, they used to organize singing sessions where people get together, they sing, they do breathing exercises so that people with COPD and with asthma and other respiratory conditions can improve the lung function and can interact with each other. Now, because of the lockdown, there are quite a number of changes in how the group operates, and our app may help with that as well. So with this group, and by trying to co-develop with the community, we had about 230 interviews, including 30 extended interviews, to see what people with COPD would like to see in a digital tool. We also had focus group studies with patients and family members, with carers, which was facilitated by the Chain Gang to specifically see how to improve the user experience and the user interface. And also we ran so-called ethnographic studies where we spent a large amount of time with individual patients or people with conditions, people with COPD, asking what could be the important issues for them. And so that we can build this into the digital app, which people will then be able to use. We are now developing personalized exercises with respiratory nurses and GP nurses from the Chain Gang so that people can practice breathing at home with the guidance and with the exercise sets suggested based on the patterns which we can see in the data, in the people-generated data, in the user data. And we are engaging Scottish health boards to refine what we are doing using the NHS data, and potentially to augment, to use our app as part of the standard care, as a component of an existing care pathway in the NHS. I will now, just before going to the tour of how things look like at the moment, I will show the snapshots. Basically, it's a tablet view of our app, which runs either on a tablet or on a phone or as a web page. And basically, this is basically a web page created by Chain Gang, which who update home exercises every week, where they can sing. People can watch the videos and sing. I will share the new screen. I will share the screen of the app, and let's just hope that this works. So what's on my screen at the moment? Let me basically use the full screen view. It's a tablet view of the app where people are asked to submit today's symptoms. There are multiple interfaces how this can be done. For example, do they have the cold? Do they have the wheeze? Do they have the sore throat? Now it's possible to change the things. We are adding the voice support for this as well, so that people can submit their symptoms using voice. Then they can submit the results and get a risk score, an exacerbation risk score for today based on the submitted symptoms. Moreover, predictions for tomorrow are used to guide the choice of online resources. So we can see that based on the risk scores for individual symptoms and based on the predictions which we can see in the data, there are resources usually from trusted websites, such as the COPD Foundation in the United States, or the British Lung Foundation, or Asthma UK, who develop, who have recently joined forces with British Lung Foundation. Based on the symptoms which we can see and on the predictions which we can generate based on the patient-generated data, user data, we can suggest trusted sources of information. There are things like breathing techniques, breathing for relaxation exercises, where people can just choose the videos they like. I hope this works. Um, Yes, you cannot hear the music, but basically based on the suggested patterns of the breathing cycles, which we can see in the data, people can breathe in and out and watch videos and listen to the music. They can select the theme of the videos. And again, the suggestions for how quickly they can breathe in or out, it's modifiable either by the nurses or by the algorithms, and there are configurations of how quickly this can be done. So there is a lot of content here, and people who stay at home and who want to do some breathing exercises potentially, or who want to track their symptoms, can potentially do this using our app. There are videos and information on common inhaler mistakes, as well as common videos and instructions of how to use multiple types of inhalers. I think this is largely based on the content from Asthma UK, and also the content co-developed with Chain Gang. Breathing techniques, various videos. I won't go to the practice session because of the internet connection. But basically, the user-generated content and symptoms, and we can track symptoms through time as well, that generates personalized training programs and relaxation programs and video programs. Our colleagues from the Chain Gang, they are developing home exercise videos, which will be included in the app, and we are working on this now. So basically 7 days ago, they recorded, for example, this video session. It's possible to go through the videos and sing the songs, do the breathing exercises with the Chain Gang coaches. Again, this will be included in the app as well. So I will now go to the COVID-19 session and to the COVID-19 chunk of section of the app. I will stop sharing and share my screen once again. We are at the COVID-19 section, which is still experimental, which is available as a standalone app, and which is available also as a web page. It's specifically focuses on COVID-19 for people who have COPD or who do not have COPD. Basically, the way it works is that patients, people are asked whether or not they have symptoms of COVID-19. For example, they may decide to answer no. Are they living alone or no? Say they're living alone, yes. Do they have COPD? Yes. Based on the answers to the questions, they get the guidance, which is developed by the NHS England and NHS Scotland, also colleagues from the CDC in the United States, British Lung Foundation, from trusted resources. This information is basically mined, tracked for changes using our algorithms, and then aggregated into a form which people can understand. And they get personalized guidance on how to stay informed, how to, for example, follow the prevention advice. This is based on the aggregation of resources from multiple different sources of information, and the information which we are showing is specific to the answers to questions which people have provided. So instead of looking at one big list of results and recommended guidance as on public health websites, they can get the advice which is specific to them. If people say that they have COPD, they get access to a printable leaflet on COVID-19 in COPD, and also to the interactive version of the leaflet, which they can see the guidance which we have put together based on the latest evidence which we were able to find in the literature. People can go and print this out. What could be the common symptoms of COVID-19, how to differentiate COVID-19 from exacerbations of COPD, what to do in relation to this. Every time we basically give the evidence sources like BMJ, British Medical Journal best practice, for COVID-19 and acute exacerbations of COPD, also the latest evidence from COPD Foundation and British Lung Foundation. When we see a new piece of evidence, we add this to our webpage and to the leaflet which people can download and print. They also get the typical guidance of when to call 999 or how to seek medical help and when to do this. They get the typical information on how to live with COPD during the coronavirus pandemic, basically on how to self-manage stable COPD, and also how to self-manage COPD exacerbations and when to seek medical advice. Also, when we can see the guidance, the latest guidance on when to use steroid inhalers or steroid tablets, antibiotics, we include this as well. We are caveating this heavily. We are saying that this leaflet and the advice we give should not be used for diagnosis or treatment of medical conditions, and people should still seek medical help. But the guidance which we give here, I think just facilitates the search over multiple resources so that people don't need to go to multiple websites which are considered to be trusted, coming from the trusted charities or coming from the NHS. They get the information on COVID-19 in a single place. And there are other sections in this COVID-19 COPD webpage. For example, one can get access to the latest information on COVID-19 in Scotland. For instance, we can look at how many new cases we had yesterday. It was last updated yesterday in the evening, so 6 new cases at Tayside. There was 1 new case in Lothian. You can see how many cases we've got per 1 million and also per 100 square kilometers. We can look at the maps and zoom in and see what's going to happen, for example, here in Glasgow. Basically, just some basic information about the situation in Scotland and England at the moment. The guidelines we have discussed. One potentially interesting aspect is about analysis of the latest evidence. We are maintaining, I think this is mostly clinician-facing part of our resource. We are maintaining what may be the world's most complete piece of information on how to prevent mortality due to COVID-19 in COPD and how to prevent severe COVID-19 in people with COPD. So there are multiple literature sources, links to the original information. There is our own aggregation of which is called meta-analysis, aggregation of the results and risk assessment, which can help to guide clinical decisions based on the latest evidence. Clinicians who can access this website can get information about the latest scientific evidence. They can go back to the original papers. For example, I just clicked on a paper which in this case looks like it was published by people from Shanghai. It's a preprint in this specific case, and it's one of those papers which study COPD and COVID-19. So by using the clinical analysis section of our webpage, people can access the latest information from the medical literature. I will share my slides again and stop sharing the app at the moment. One other thing which is happening just at this moment as we speak is that we are developing new physical and breathing exercises which would help people with COVID-19 or other people during this post-COVID-19 world. So multiple videos shot in relatively nice surroundings with multiple exercise sets to cover COPD, to cover people who otherwise don't have lung conditions but who have had COVID-19, and then people who had COPD and COVID-19. I can show those videos, how those videos look like. Those videos are basically put together in an app at the moment based on recommendations and patterns which we can see in the data. So currently it's just a collection of the videos which will be available as a part of of the app. And you can probably see the screen. You cannot really listen to the music, but there are different choices for different people based on disease severity and based on whether they had lung preconditions. I will go back to the presentation. So to summarize this resource on COVID-19 and COPD, we are tracking the latest information on COVID-19 in Scotland per board, per location, the number of cases per 100 square kilometers or per million population in each region. We are updating the latest guidance based on answers to specific questions. We are maintaining what may be the world's most complete resource on scientific evidence on COPD and COVID-19. We have also got the interactive leaflet on self-management of COPD during COVID-19. Now it's being approved by the US, by the NHS in Lausanne. And some early testimonials from the users. We have checked this, and we are checking this with respiratory consultants and clinicians. Some early testimonials. The leaflet has been appreciated by every respiratory team on Lausanne. We are getting it authorized for use. So that was the COPD lead. I really like this. Better than any patient info I have seen so far. Respiratory consultant. Nice work on COPD COVID-19 outcomes meta-analysis. I haven't seen anything more complete. Another respiratory consultant and a different health board. This is so very helpful. How can I send you a box of chocolate? It was a COPD patient. And to summarize where all this is going, we are working on self-management of lung conditions in this post-COVID-19 world. We are using artificial intelligence to scan thousands of medical articles every week. I can answer questions about this if people are interested, but basically our AI helps to ensure that our summaries are up to date and complete. We are developing exercises with patient support groups and with end users, and again, recommendations of the exercises such as the duration of the breathing cycle or physical exercises. It's modifiable, and to some extent it's guided by the algorithms, but carers have the right and have the flexibility to override what our algorithms are suggesting. And we are working with the NHS towards endorsement and validation. The COVID-19 work is supported by this European project, which we are involved in, and the IT work and AI work is partially supported by Innovate UK, and we are funding this quite extensively ourselves. So it's basically the take-home and contact slide. If someone is interested, we are open to collaboration with people. Our current focus is on COPD, but generally we are interested in summarizing scientific findings in COVID-19 for other preconditions and generally improving self-management during COVID-19 by using artificial intelligence. We're happy to speak, happy to discuss this, to see how we can help. Thank you very much. This is the end of this presentation, and I'm happy to answer questions.
Thank you so much, Felix, for that presentation. I found it really interesting, and we have some questions that I'd like to quickly ask. So we have a question from Joanna, who's asking, how does Care AI compare to the My COPD app? Does it provide much of the same, or does your product have a different approach?
My COPD app, as far as we know, does not use AI. At least it hasn't used AI when we checked it. It's very useful educational app. It does not have this option of submitting symptoms and getting predictions for today and tomorrow until the end of today and until the end of tomorrow within 24 hours. And when we discussed the functionality of our app with a large number of people with COPD, basically these are some of the numbers of people whom we spoke with. This functionality of being able to stay informed and getting predictions in advance, getting answers to whether it is a bad day or whether it is an exacerbation of COPD. These are critical questions which AI can help with, but tools which don't use AI and cannot predict what's likely to happen next are unable to help with. I think one answer is that we can predict what's going to happen tomorrow and base our guidance on that. And the second part of the answer is that this summary of the information about COVID-19 in COPD would be very difficult to do without AI. Every week we see about 5,000 publications now on COVID-19 and probably several hundred publications on COVID-19 in COPD. Aggregating this information, putting this into use in the form of the app would not be easy without AI, and I think we're the only ones who are doing this now.
Thank you. And then another question was from Gail, and she was asking whether this app is currently up and running at the present, and I understand it is. And then she was also asking if the information collected can be shared digitally with practice nurses or consultants.
It's, thank you for both of those questions. The app is running. If you contact us, we can give you the link to the app. We are not making it widely available, but we can give the link to the app to anyone who is interested in using this. The reason for it is that we're still undergoing validations and endorsement. We are working towards the endorsement with NHS Lothian. Once it is endorsed, we will be able to put the NHS tag on it, and we will be able to share it more widely. The question, there was a second part of this question about sharing the data with the consultants. This is under development at the moment. We were collecting this information. We are people who are using the app can opt in or opt out from us sharing this information with consultants.
Thank you. I'm aware of time, but we still have two more questions, which I'll quickly pose. And thank you so much for everyone who has been joining us. So Frank Toner from British Lung Foundation and AUK asking, do you have any idea how much this could save the NHS based on reducing the number of emergency hospital admissions? As we are likely to move more towards digital solutions to respiratory care, would this app be able to speak to smart inhalers? Currently, my COPD app is not available to all patients across all health boards. Is it anticipated that this app would be available to all?
Very good questions. I appreciate these questions. I think in terms of how much we can save, we have done the analysis, we have made the estimates of that. I think I haven't got the figures with me. We can see that under a wide range of assumptions which we can make about the reduction in hospitalizations and reduction in the length of stay, we expect to see between £190 a year per patient saved to about £850 per year based on severity of COPD. I cannot give the exact figures and the exact layouts to this question, but yes, we will be able to save mostly because of preventing admissions and reducing the length of stay due to the earlier differentiation of bad days and exacerbations and earlier self-management treatment. In terms of smart inhalers, yes, we are working on this. We are working basically on integrating the, not only collecting symptom data, but getting the data from the wearables. This part is working. We have also got smart inhalers and integrating with smart inhalers where we can see access to the open API. So the work is ongoing on this. In terms of making this available across multiple NHS boards and across multiple trusts, the idea is to make it as widely available as possible. And we are starting in Scotland, but we are working with 2 boards in Scotland at the moment and also with 1 NHS trust in England, hoping to make it available throughout all trusts and boards.
Thank you. And the final question, what evidence do you have about the accuracy of the predictions for tomorrow?
Good question. We have retrospective evidence in people who haven't been used for developing the algorithms. We published a paper in the Journal of Medical Internet Research, JMIR, which is the most prestigious journal in digital health, where we give details of this. We can see that for the same level of sensitivity, our level of specificity, basically, and the reduction in the false positive rates is about 3 times better than the current exacerbation scores, which are used in clinical practice. I'll be happy to answer this question in more technical detail if these questions are directed to our website. We have retrospective evidence at the moment. The work which we are doing with Innovate UK is to get us to the stage where we can run the clinical trial, which will be able to demonstrate the effectiveness prospectively.
Thank you so much. There was one additional question on the charge for using Care AI for organizations or individuals.
Currently, we are still at the development stage. We hope that there will be no out-of-pocket costs. We envisage that basically commercialization will be through commissioners, COPD commissioners, and also through business-to-business offerings. Basically, I haven't really spoken about this, but a part of a potential use of this app is to enroll people in clinical trials of new medications in COPD if they're willing to do so. So every user of the app will have an opportunity to volunteer or opt out from taking part in future clinical trials. And we hope that our support, Care AI's support of future clinical trials will help to make this app it will make it free to the end users, and it will make it as affordable to the NHS as possible through business-to-business offerings.
Thank you, Felix, and thank you so much to all of our participants who joined us. I do apologize for running slightly over, but I didn't want to leave any questions unanswered. So that brings us to the end of the webinar. Thank you once again for the fantastic presentation, Felix, and for answering those questions. We hope that it has provided some insight and takeaways to bring to your own organization. If you have any further questions, you can get in touch with us at live@alliance-scotland.org.uk, or you can reach us on Twitter at @AllianceScot. So a big thank you to everyone once again, and make sure to check our YouTube channel for other relevant content, and keep an eye on our Twitter for the latest health and social care updates. Thank you very much, and I hope everyone has a good day.
Thank you very much.
Thank you.